Hello, I'm Kayla Roman, and I'll be highlighting top professionals providing senior financial services. Today, we're meeting with Tony. Hi, Tony.
Hi, Kayla.
How are you today?
Very well. How are you?
Good. Do you want to start off by just telling me a little bit about yourself, maybe your hobbies, what you like to do in your free time when you're not working?
Sure. I have six children and a wife, so we are continually busy with them. One is out of college, and we have still a fourth grader. So, needless to say, we're always on the run, sporting events, fishing, camping, just doing a lot of outdoor stuff. So,
Yeah. Wow, six kids. I bet you definitely stay busy. I've been staying busy with one.
yeah, without a doubt. But yeah, I don't know, one or six, it's all the same. They keep you
Yeah.
busy. Period.
They say after two, they just start taking care of each other.
Not necessarily, but maybe when they start driving, that helps a lot.
Yeah.
So,
Yeah. What led you to working with seniors on their specialized financial needs?
well, Kayla, I have an accounting degree, and so out of college, I did that for several years, and then gradually got into sales. And fortunately, an individual asked me to sit with him as he was going on to an insurance appointment. And within 3 minutes, I knew it's just something that fits my style. I like to help people. With the accounting background, it enables me to offer value to individuals that they may not be aware of. And it's the analytical side of it as well helps me to kind of target coverages and plans that will help individuals.
How did you get into insurance in general?
As I mentioned, the individual asked me if I wanted to take a ride with him, and so he sold long-term care insurance. So I started doing that, and then gradually went into just a variety of products. And the last 10 years or so, I've really targeted the senior market as I saw a need there that I could really help individuals, in their situations that they needed help with.
What do you think is one of the biggest challenges that you see your clients facing regarding their financial situations?
Well, from a financial situation, uh, tying in with Medicare, a lot of individuals simply are unaware of what is available. So they make decisions that either leave out providers that they really need, or they need providers that they didn't anticipate using. So I kind of help people proactively understand what their needs may be down the road if they're healthy right now, or individuals that do need care right now. We make sure that everything is going to be in order where they can locate professionals that they need, the
Yeah.
doctors and physicians to help them.
Without divulging any specific details, can you tell me about a time where you helped a client achieve one of those goals and overcome one of these challenges that like really stuck out to you?
Yeah, absolutely, Kayla. So many years ago, I was sitting with a lady who had back surgery prior to our meeting, and she was just in a tremendous amount of pain. And she was referred to me from her sister, and she could not see the surgeon to correct her back problem that was caused by a prior surgery because of the plan that she was on. The neurosurgeon was not in the network. And so we were able to get her onto a plan where, within the month that she was on her new plan that I'd recommended to her, she was able to have the surgery done and the initial back surgery corrected. And so it was tremendously beneficial. And at that point, I realized, okay, this is really, I want to pinpoint what I do down to the Medicare in planning for seniors.
If you had a crystal ball and you could see into the future, what do you think is going to be the biggest challenge for seniors in the next 3 to 5 years?
Well, that's a good question, because this could run from anywhere from funding from the federal government to, I think a bigger issue that we're encountering right now is a lack of providers that are getting into, the newer individuals getting into the profession, physicians, specialists, et cetera, even primary care providers, where we're now seeing a lot of physician assistants handling those services and needs. So I think the biggest issue that they're going to be facing right now in the next 3 to 5 years will be a lack of providers, which is kind of scary, especially with an aging population.
And just like being able to make sure that they have somebody that can help them understand like what their options are is going to be huge.
Absolutely. Absolutely. Yeah, because a lot of people are not familiar with, if they're not doctoring with something right now, they don't anticipate for the most part of dealing with something later and then finding a physician that can handle those needs within a particular plan. And that's a big concern for me. My parents are elderly. My mother has MS. So it's been a continual situation where we make sure, okay, if something happens tomorrow that we're unaware of, where will she be best suited to find practitioners that she needs? And that's a driving force. I have a lot of calls on a yearly basis from individuals that say, what are you going to put your parents into next year? And they don't even pay attention to the literature that I send out to them for my recommendations for the coming year. They just say, what are your parents going to do? I want to be in the same plan your parents are. So I really just, I love helping people and, and just helping them anticipate things that can happen and have those addressed before they even happen. And it shows. I have almost all of my business is word of mouth referrals, and it's been that way for a number of years. And it's just, I'm glad I focused solely on the senior market and those individuals on disability because I think it was an underserved market.
I think one of the coolest things you said is how people will say, I want whatever your parents have, because it's like that line of trust with you. I do the same thing. I have like some heart issues. And like when I go to my heart doctor, I always say like, I want you to treat me exactly like you would treat your sister. Like, how would you, handle the situation? So
absolutely, yes.
Yeah, it's important for people to know that they can trust you. And it sounds like they really do. So
thank you.
Well, Tony, that's all I have for you today. Thank you so much for meeting with me and just sharing a little bit about yourself and a little bit about what you do.
Well, thank you, Kelly. I appreciate you taking the time to help me with this.
All right. Thank you.
Have a wonderful day. Bye-bye.